Hey everyone, Paul Bertorelli reporting for AVweb with an update on how COVID-19 has impacted aviation and specifically flight training. To say it has been dramatic is an understatement. Not all schools stopped flying, but many did, and all have been impacted in some way. So we'll start this report with a survey of 3 flight schools, all in different parts of the country.
Of course, flight schools large and small have had to deal with the COVID-19 problem. One of the larger ones is University of North Dakota. And then the other little screen here on the other side is Jeremy Rossler of UND. Jeremy, you shut down middle of March after spring break or right around spring break. Now here we are at the beginning of June. You're starting to get reestablished. What kinds of things have you done and how are the procedures working out?
Well, we've done a lot, and it's been a tremendous effort by our team to develop a lot of these procedures. And first off, we screen everybody that comes into the facility. So we have one entry point into our facility, and everyone has to fill out a screening form that identifies if they've been around anybody that knowingly with COVID or exposing any symptoms, their temperature, things like that. And that's the security measures that we have in place to even let the person into the building itself. For actual flight training, we are requiring that both the student and the flight instructor to wear a mask. Gloves are optional, but we're wiping down and cleaning the aircraft prior to every single flight. And that includes our ground training devices, our ATDs. We're wiping everything down. Anytime that an individual cannot maintain 6-foot separation in our facilities, we are wearing masks. We've converted one of our hangars next to our dispatch area where we've moved all the furniture in there, and that instead of parking airplanes in there, now we have areas for people to meet and do their pre and post-flight discussions. So it's along with all our policies that we've developed for, what if a student or employee says that they were tested or we come across a positive test? We have a lot of these mitigating factors in place today.
And how many students there, and have you had any cases?
We have, well, when we started the year 2020, we had 1,400 students on the flight schedule. And just today, we're gradually inviting more students back to the flight line. We're just not flipping on the lights and saying, okay, everyone come back. So right now we're sitting at about 500 students that have been invited back to the flight line. Just today, I recalled all of our flight instructors, and it's up to them whether they return or not. They're not forced back, so if they want to take more time away, that's perfectly fine. But we have not had any positive cases of COVID. We've had a couple tests, and we had a couple students identify that they've been around an individual with a positive test. But all of our procedures about 14-day quarantine have worked out, and luckily we have not experienced a positive test to date.
And what are you doing for the classroom work?
Right now this summer, all classroom work is online. So that continues, and the details as far as the fall semester is still being worked out. So a little too early to tell how the fall. The university plans to hold classes on campus, but exactly how that's going to work, those details are still in process.
And what do you sense is the overall impact of this on the ongoing operation? I mean, it certainly introduces an inefficiency, but is it much of an inefficiency?
Well, I mean, obviously there's a financial toll that's gone on. Being shut down for 2.5 months, that's a big financial hole that you have to try to fill. And at the same time, you do have employees and students that are a little wary about coming back. They want to make sure that it's safe and that it's the right decision. We're not forcing anyone back, so that's important. But it's just good to hear airplanes flying again. A busy day for us is about 500 to 600 hours of flight time in one day. Today we hit 50 hours of flight training time. So that just illustrates just how slowly we're starting up just to get these procedures to work out. But next week I'm expecting to be a pretty busy week.
And are you seeing these procedures in place for the foreseeable future?
Yeah, we plan to have these procedures in place for, I mean, the rest of the summer, and we already know a lot of this stuff is going to exist in the fall. It's just going to, you know, it's tough to predict what's going to happen. So we're going to be very cognizant of what's going on nationally and with our state government and with the university, and follow the appropriate procedures.
Okay, well, thanks a lot for giving us the briefing, Jeremy.
Absolutely. Thank you.
Among the many flight schools in the U.S. is Wayman Aviation Academy. They're in Opelika, Florida. Wayman, I've known you for a long time. You've got a busy training operation there. What kind of steps have you taken in the way the flight school operates and how you handle cockpit flying?
Back in second half of March, we have a 7-page CDC COVID-19 guideline document on a PDF, and we've published it via ForeFlight to our students and staff, and of course we have written paper ones. And pretty much we follow the CDC guidelines. Everybody, please wear your mask in the building, walking out to the aircraft briefing, in the aircraft, please wear your mask. Also, after every flight, we contact our maintenance team. They go there with diluted denatured alcohol and wipe the door frames, the handles, the control wheels, the dashboard, the seats, the seatbelt buckles, the oil dipstick door on the cowling, the fuel tester. You know, it's very important, all that. And we ask everybody, wash your hands, wash your hands, wash your hands. Like most places, we do have an infrared thermometer to take everybody's temperature whenever they report for a flight, and we have a log sheet on a clipboard where we keep everybody's temperatures daily track. And of course, we ask people to, if they have a temperature or runny nose, please just stay home until that passes.
And you're doing all your ground school online?
Yes, sir. We're doing our formal ground school via Zoom. And then we're trying to do as much as our one-on-one, also online briefings, debriefings, just get it done online ahead of time. We're using Zoom and Google Hangouts for video conferencing for the formal ground school, one-on-one ground school oral on Zoom and Google Hangouts, and also the briefing debrief time.
How disruptive has this been for your regular operations? It sounds like you're doing pretty well at it.
In early March, April, a lot of people self-quarantine. And also we are scheduling half of our flights that were before to keep separation and people to a minimum in the flights. But before, we'll to everybody at 7 a.m. so they could go fly early in the morning. Now we schedule each airplane about 15 minutes apart so that we don't have that many people inside the building at any one time.
As I mentioned in the intro, there are a lot of flight schools in the U.S., large and small. One of the smaller family-owned ones is CP Aviation. They're in Santa Paula, California. And with me from that school is Judy Phelps. Judy, you've been instructing there and running the flight school for quite some time. Shut down in the middle of March. Now you've just come back. What kind of precautions are you taking for the instructors and the students?
Okay, so for the instructors and the students in the airplanes, what we're doing is everybody's wearing a mask. So that's probably the most important thing. And we also have our line crew sanitizing the airplanes. And so we did a lot of research, because you can't just sanitize the airplanes with anything, because then you start ruining, you know, your GPSs, and the buttons get all gummy, because a lot of those cleaners, they make things sticky. So what we did after doing some research is we came up with, we're using actually a bleach water solution. So after every flight, our line guys they've got a spray bottle with the bleach water and like a microfiber towel and stuff that they're wiping down all the control surfaces with. And then as far as the GPS units themselves are concerned, like in all the knobs and stuff on the radios, we're using like a alcohol, like you buy those little packages that have the alcohol wipes in them. And that seems to be working well for us. As far as the flight school environment in the classroom, we've had to change. We don't have like separate little cubicles for our students or separate places. We've always just had one classroom where everybody gets together. And so it's a relatively small space. We have 2 tables, but now we only allow people in the classroom if they're teaching, and we only allow 4 people back there at a time. So we have 2 tables and we keep people apart from each other. And so one of the challenges has been for us is we have, you got people that come and they're here, they want to kind of hang out. Well, now we can't let them hang out in our office. So fortunately, it hasn't been super, super hot. So what we've been doing is we've been hanging out on the patio over at the restaurant, or we've just got chairs and stuff kind of scattered outside. It seems to be working okay for us.
And how is it to use the masks in the airplane?
It is, when it's hot, I'm going to just use the word miserable, because you can't breathe. You get this hot mask on your face. And so actually what I've done is I've resorted to a neck gaiter, and I actually took it and cut it in half, and then I put some like little fringy stuff on the bottom of it. It doesn't look the greatest, but I have found that that is helping, making me more comfortable in the airplane. The other thing that I have found using the mask is if you've got air, if you get it's when you got that dead air, like when you first get in the airplane and you haven't started the engine and there's no wind or anything. Once you get flying and you get the air vents open and stuff, it's actually not that bad. And as far as like the mic muff, if you get it close to your mask, it's no problem, talking and communicating. Sometimes you got to talk a little bit louder so that people can hear you.
And what about ventilation in the cockpit? I mean, you can only do so much, right? The vents are open, and on the ground,
vents are open.
You can open a
Yesterday
door
it
or
was hot,
window.
windows were open. So yesterday I was flying around with the windows open. And then, of course, they tell us not to touch our face. So the one thing good about having a mask on is if you have that mask on, there's less, if you do think about your touching your face, you're more aware of it. And then, of course, we're washing our hands, before we get in the airplane, after we get out of the airplane, and all the things that the CDC is telling us to do.
Okay, now the loaded question to close this up. Does this feel like it's worth it to you as far as mitigating the risk, or do you feel the risk is overstated?
I don't know. That's kind of a hard one for me, because it's just I think the thing that I have the hardest time with is they keep changing their mind. So it's like it seems like nobody really knows. First they tell us don't wear a mask, then they tell us wear a mask. And so I just get the feeling some of the time that nobody really knows for certain. And because of that, it makes it hard to make a decision. So as far as the risk part of it goes, I feel like if we take all the precautions, that we're doing the right thing, because you can't just lock yourself up in your house forever.
So we've seen what flight schools are doing out there, and so far so good, but can we get any sense of the real infection risk? And to discuss that, we've got Rob Shmerling of Harvard. He's involved in the publications there at Harvard and is on the medical staff and is well positioned to keep an eye on all the research that's going on around COVID-19. And that is a lot. So Rob, you've seen what we're doing in the flight school world. Characterize for us the real risk out there. Can we put any kinds of meaningful numbers on it?
I'm not sure there's any precise numbers that I could quote you or that any expert could give, but I would think about risk of COVID or contracting the infection, the viral infection that causes COVID, as low or medium or high, and certainly a enclosed space with poor or low air ventilation, with people who are not wearing masks, maybe who are coughing for a prolonged period, that would be considered high risk. Whereas something that's outdoors, brief exposure to someone else, that would be considered low risk. So I think in terms more of those categories than I do of specific numbers.
Well, in that sense, then a cockpit certainly qualifies because it's a very small area. Of course, you hope that whoever is in it that doesn't have any symptoms, isn't coughing, isn't sneezing. You can ventilate it pretty well, but it's not like an airline cabin, and it's certainly not like being outdoors. Let me ask you this. Here where I live, I'm in Sarasota County, Florida. We've had about 650 or so cases. And that works out to a rate of, according to my notes, about 163 per 100,000. Fairly small number. I mean, that's 1.6 in 1,000. So it's not really a lot, but that doesn't really necessarily give me an accurate risk assessment, does it?
No, it really doesn't, and there's a couple of reasons for that. One is that most experts think that the numbers that are reported are underestimates. So some people have been infected and either didn't know it, didn't get tested, perhaps they died of something else and it was never considered. And the other reason is that those numbers reflect what happened in the setting or in the context of mitigation efforts. So people started wearing masks, people started socially distancing and quarantining. And so the low numbers in many parts of the country are great, but it's important to keep in mind that that could be, at least in part, and maybe in large part, because of the mitigation efforts that were taken. So it's tricky that if you relax the mitigation efforts, the numbers might certainly be higher, and they may have been higher had they not been done in the first place.
And so from that, can I conclude then it really doesn't matter if you have a lot of local cases or very few cases as far as real risk, because people travel, they come from places of varying degrees of prevalence, so you really don't know what you're dealing with.
Well, I would agree with that, except for one point or one caveat or addition that I would emphasize, and that is that if community spread is common where you are and where you're living, then that will speak to a higher risk for folks who are maybe coming from the local area to the flight school.
And what's the current thinking and the direction of research on the effectiveness of masks?
That's a great question, because I think a lot of people, whether by intuition or by the current guidelines, assume that they're pretty effective. But I think in medical settings, the N95 masks and the surgical masks have certainly proven effective. But the T-shirt covering one's mouth or the bandana covering your mouth and nose, the homemade masks, I think have not really been well researched in terms of effectiveness. So most experts will suggest doing it. I think it's considered a low risk and low cost thing that you can do. So at least you have some control over what mitigation efforts you're taking on your own. But it hasn't, in my view, from looking at what has been reported in the research, I don't think it's been well established to be highly effective.
What about your own mask use? Do you adhere to it?
I do. In part, I do it because I think it's expected from other people. And since wearing the mask is to protect others from me, I feel like I have a bit of an obligation to make that effort. And in some settings, it's required. So I wear masks, of course, to go to a grocery store where it says, no mask, no service. In elevator shafts, in an apartment building where the sign says you have to wear a mask. So in a lot of settings where I think there's at least some risk and it's required, I certainly wear a mask. But outdoors, away from others, I don't.
Last question, where do you stand personally on airline travel?
Well, it's interesting. I think that the absolute risk, again, as we talked about earlier, for many of these things is uncertain. I'm not aware of any reports of outbreaks related to air travel, any large numbers. And so then there's my personal decision is to not fly now unless I absolutely have to for some sort of emergency or urgent issue. But I have heard, and I am swayed by Tony Fauci and Leanna Wen, both on major networks, suggesting to the public that maybe now isn't the time for a flight for pleasure, and that driving might be safer than flying. And so taken together and also integrating the risk averseness of my wife and my own personal risk tolerance, I think right now I stand on the side of not flying.
Okay, well, thanks very much, Rob Shmerling of Harvard. We appreciate your perspective. We will probably come back to you in a few weeks or months to see where we stand.
Well, thanks for having me.
Okay.
So to summarize here, what we really know is that the risk of COVID-19 transmission may be low generally, but it's high in some specific circumstances, such as small, tightly enclosed spaces. And that pretty much describes an aircraft cockpit. So here's a short checklist of what schools are doing. Maintain physical distance where possible, at least 6 feet. Stagger scheduling so as few people as possible are in buildings and hangars at the same time. Try to conduct meetings, briefings, and ground school online where practical. Keep hand sanitizer available everywhere. Sanitize frequently touched surfaces as much as practical inside the aircraft. Use masks in the cockpit and keep the ventilation flowing as high as possible. If all this sounds like ridiculous overkill, it may very well be. But as pilots, instructors, and flight school operators, we're on our own to decide to do some of it, all of it, or none of it. For AVweb, I'm Paul Bertorelli. Thanks for watching.